Breast development is a natural and important process that all women go through, starting during puberty and continuing throughout life. It's influenced by a variety of factors like genetics, hormones, and lifestyle choices. Understanding this process can help women feel more empowered and comfortable in their bodies. The image on this slide shows a woman celebrating her breast development in a positive, empowering way. This slide provides an overview of the key points about breast development that I'll be covering in more detail in the presentation. Breast development is a natural biological process that starts during puberty and continues into adulthood. It's driven by hormonal changes, particularly fluctuations in estrogen and progesterone, which stimulate the growth and maturation of breast tissue. This results in the visible enlargement and shaping of the breasts, as well as changes to the nipples and areolas. Ultimately, breast development prepares the body for potential breastfeeding, though not all individuals choose to or are able to breastfeed. The first stage of breast development is the appearance of small breast buds under the nipple as estrogen levels rise during puberty. Over the next few years, the breasts gradually grow larger, developing more fat, glandular, and connective tissue. This growth is often asymmetrical, with one breast sometimes developing faster than the other. By the end of puberty, the breasts reach their full mature size and shape, with the areola and nipple also fully developed. This timeline illustrates the key stages of natural breast development that occur during adolescence as a girl goes through puberty. Breast development begins with the formation of small breast buds under the nipple as estrogen levels rise during puberty. This initial stage of breast development is called thelarche. Thelarche typically starts between the ages of 8 to 13 and marks the beginning of the puberty process. The breast buds are the first visible signs that a girl is entering puberty and beginning the process of breast development. The initial stages of breast development begin with the formation of small breast buds under the nipple as estrogen levels rise during puberty. Over the next few years, the breasts gradually grow in size as they accumulate more fat, glandular, and connective tissue. This expansion often occurs unevenly at first. By the end of puberty, the breasts reach their full adult size and shape, with the areola and nipple also reaching their final form. Genetics play a key role in determining breast size, shape, and development timeline. Certain gene variations can predispose someone to larger or smaller breasts. Hormonal fluctuations, especially of estrogen and progesterone, are the primary driver of breast development. Changes in hormone levels throughout life impact breast changes. Diet and nutrition can influence breast size, with a balanced intake of nutrients like healthy fats, proteins, and vitamins supporting optimal breast development. Regular exercise and physical activity levels have been shown to affect breast size, with more active individuals often having smaller breasts on average. Genetics play a key role in determining an individual's breast size, shape, and development timeline. Certain genetic variants can predispose someone to having larger or smaller breasts. Hormonal fluctuations, especially of estrogen and progesterone, are the primary biological drivers of breast development. Changes in hormone levels throughout life impact the growth and changes in breast tissue. Understanding the interplay between genetics and hormones is crucial for understanding breast development. A balanced, nutrient-rich diet can support optimal breast growth and size. This includes healthy fats, proteins, and a variety of vitamins and minerals. Highly processed, sugary, and high-fat foods may have a negative impact on breast development, so it's best to limit their consumption. Moderate intake of soy-based foods may help support breast tissue growth. However, excessive soy consumption is not recommended. The key is to focus on a well-rounded, healthy diet to provide the necessary nutrients for proper breast development. Regular exercise like running, swimming, or strength training can help maintain a healthy breast size by regulating hormones and body composition. Resistance exercises that target the chest muscles can help build up the underlying breast tissue, potentially leading to a fuller breast appearance. A lack of physical activity and a more sedentary lifestyle may contribute to increased breast size over time due to factors like weight gain and hormonal changes. Intensive, high-impact exercises like plyometrics or HIIT training can potentially lead to a slight decrease in breast size by reducing overall body fat percentage. The timeline on this slide shows the key stages of breast development that occur during puberty and beyond. We start with the first visible signs of breast development, called breast buds or thelarche, which appear as small bumps under the nipple. Over the next several years, the breasts gradually grow larger as they accumulate more fat, glandular, and connective tissue. By the end of puberty, the breasts reach their full adult size and shape, with the areola and nipple also reaching their final form. Breasts may continue to change in size and shape throughout a woman's life, influenced by factors like hormones, pregnancy, and menopause. The illustrations on the right help visualize these key stages of breast development. Variations in breast development are very common and normal. One breast may be slightly larger than the other. This is often due to natural anatomical differences or hormonal changes. The timing of breast development can vary, with some experiencing breast budding earlier or later than average. Breast size can differ greatly between individuals, influenced by factors like genetics, body type, and hormones. Breasts may continue to change in size and shape over a woman's lifetime, especially during major life events like pregnancy and menopause. Breast asymmetry is a very common and natural variation, with one breast often developing slightly larger than the other. This is usually due to normal differences in our bodies or minor hormonal fluctuations and doesn't require any medical treatment. While noticeable, breast asymmetry is simply a normal part of the diversity of human bodies. Learning to embrace and appreciate your unique breast shape and size can help build self-love and body confidence. There's no need to feel self-conscious about natural variations like this. They're simply part of what makes each of us unique. Breast development is a natural process that typically begins between ages 8 to 13 with the appearance of small breast buds, followed by gradual enlargement during puberty. However, in some individuals, the initial breast bud stage, known as thelarche, may be delayed until a later age, often due to genetic or hormonal factors. When breast development is delayed, the breasts may take longer to fully mature and reach their adult size and shape compared to the typical timeline. If breast development is significantly delayed, it's important to consult a healthcare provider to rule out any underlying medical conditions and provide guidance and support. Remember, every person's body develops at their own pace, and delayed breast development is not uncommon. The key is to be patient, seek medical advice if needed, and focus on overall health and well-being. Early breast development, or precocious puberty, can be caused by a variety of factors including genetics, hormonal imbalances, and certain medical conditions. Breast buds may appear as early as age 6 or 7, much earlier than the typical age range of 8 to 13 for the onset of puberty. This early development can lead to self-consciousness, emotional challenges, and the need for additional medical monitoring and care. However, with the right support and a positive, body-affirming mindset, individuals experiencing early breast development can learn to embrace their unique journey. It's important to provide a caring, empowering environment to help these young people navigate this experience. Puberty is a critical time of physical and hormonal changes, including the development of the breasts. The first signs of breast development, known as thelarche, typically coincide with the onset of puberty as hormone levels begin to shift. Small breast buds form under the nipple as estrogen levels rise, marking the initial stage of breast development. Over several years, the breasts gradually increase in size and fullness as they accumulate more fat, glandular, and connective tissue. The nipple and areola also undergo changes, becoming more prominent and pigmented. By the end of puberty, usually between ages 15 to 18, the breasts reach their full adult size and shape, completing the breast development process. During the first half of the menstrual cycle, rising estrogen levels cause the breasts to swell and feel more tender. Breast density and nipple sensitivity also increase as the breasts prepare for potential pregnancy. Around the time of ovulation, breasts may feel fuller and more sensitive due to the surge in estrogen and progesterone. The areolas may also darken slightly in color. In the second half of the cycle, progesterone levels rise, causing additional breast swelling and tenderness. Breasts may also feel lumpier as the milk ducts and glands expand. As hormone levels drop during menstruation, the breasts usually return to their normal, less swollen state. Any breast-related discomfort typically subsides until the next cycle begins. In early pregnancy, breasts may become larger, more tender, and the areolas may darken as hormones like estrogen and progesterone increase. As pregnancy progresses, breasts continue to grow in size and density as the milk ducts and glands expand to prepare for breastfeeding. By the third trimester, breasts are often significantly larger and may leak colostrum, the first stage of breast milk. After giving birth, the breasts may feel heavy, swollen, and engorged as the body begins producing mature breast milk. As babies begin nursing, the breasts produce more prolactin, a hormone that stimulates milk production and causes the milk ducts and glands to expand. In the early stages, the breasts may become full, firm, and swollen as they fill with milk. This is known as breast engorgement. The areolas may darken, and the nipples may become larger and more pronounced as the breasts adapt to the demands of breastfeeding. Over time, the breasts learn to regulate milk production, becoming less engorged and more comfortable as the body adjusts to the breastfeeding routine. The anatomical diagram on the slide helps illustrate these physical changes that occur in the breast during the breastfeeding process. Menopause brings a number of changes to a woman's breasts, including a decrease in breast size as estrogen levels decline. The breast tissue becomes less dense, leading to a loss of breast volume and a more sagging or drooping appearance. Menopausal women may also experience changes in breast sensitivity, with some reporting increased tenderness or discomfort. During this transition, women may be more prone to developing benign breast changes like cysts or fibroadenomas. Regular breast exams are crucial for early detection of any changes or abnormalities in the breast tissue. Routine exams allow healthcare providers to monitor the health and development of the breasts over time, which is important for maintaining overall breast health. Breast exams are a key part of proactive breast cancer screening, enabling early intervention if any issues are identified. Performing self-exams at home and getting regular clinical exams are both important steps in taking charge of your breast health. Performing regular monthly breast self-exams is important for women to become familiar with the normal look and feel of their breasts. This allows women to detect any changes or abnormalities early, which is crucial for early detection of potential issues. The self-examination technique involves using the pads of the fingers to gently examine the entire breast area, from the collarbone to the bottom of the breast, and from the armpit to the cleavage. Women should look and feel for any lumps, thickening, or changes in the size, shape, or texture of the breasts during these self-exams. Becoming self-aware of one's own breast characteristics enables women to recognize when something may be different or concerning and seek medical attention promptly. A clinical breast exam is an important part of regular breast health screening and monitoring. During the exam, a healthcare provider will visually inspect and physically feel the breast to check for any abnormalities or changes. Regular clinical breast exams are often recommended annually as part of comprehensive breast health care. If any concerns are detected during the exam, further testing like mammograms or biopsies may be suggested to take a closer look. Open communication with your healthcare provider about any breast changes or concerns is crucial for maintaining optimal breast health. Mammograms are a key tool for early detection of breast abnormalities like lumps or calcifications. They use low-dose X-rays to create detailed images of the breast tissue. This allows doctors to identify issues that may not be felt during a physical exam. Breast ultrasound is another important imaging technique. It uses sound waves to produce real-time pictures of the internal breast structures. Ultrasound is particularly helpful for evaluating dense breast tissue. Breast MRI provides highly detailed 3D images of the breasts. MRI is often used for screening high-risk individuals or investigating suspicious findings. It can reveal information that may not be visible on a mammogram or ultrasound. Breast development and cancer risk are closely linked. Individuals who experience earlier onset or rapid breast growth during puberty may face higher lifetime risk of breast cancer. This is due to the hormonal changes that drive breast development, which can also increase sensitivity to estrogen, a known risk factor for certain breast cancers. Regular breast exams and mammograms are crucial for those with a history of early or rapid breast development to detect any abnormalities or cancerous growths early. Understanding this connection empowers individuals to take proactive steps towards breast health, like self-exams and open communication with healthcare providers. Family history is a major risk factor for breast cancer. Those with close blood relatives who've had breast cancer face a higher personal risk. Certain genetic mutations like BRCA1 and BRCA2 can significantly increase a person's lifetime risk of developing breast cancer. Women with dense breast tissue, which appears whiter on mammograms, are at higher risk of breast cancer. Hormonal factors like early menstruation, late menopause, and use of certain medications can also increase breast cancer risk. The key is being aware of your personal risk factors and discussing them with your healthcare provider. This allows for proactive screening and monitoring. Regular self-exams are crucial for detecting any changes or abnormalities early, when treatment is most effective. Scheduling regular clinical breast exams with a healthcare provider is essential for comprehensive breast health screening. Following recommended breast cancer screening guidelines, including mammograms and other imaging tests, supports early detection. Maintaining a balanced diet, regular exercise, and a healthy weight can help reduce the risk of breast cancer. The presence of breast implants can disrupt the natural progression of breast development, as the implants alter the shape and size of the breasts independently of the body's hormonal changes. Breast implants can affect the breast tissue, glands, and ducts, potentially impacting the full maturation of the breasts during puberty and later in life. Breast implants may interfere with the body's ability to produce and release breast milk, making breastfeeding more difficult for some individuals. As the body continues to develop, breast implants may need to be replaced or adjusted, requiring additional surgical procedures over time. Breast reduction surgery is a procedure that reduces the size and weight of overly large breasts. This can help alleviate physical discomfort like back and neck pain and improve overall quality of life. The surgery involves removing excess breast tissue, fat, and skin to create a more proportionate breast size and shape. Recovery time can vary, but many patients report increased mobility and activity levels after the procedure. Breast reduction is a highly personal decision that requires discussion with a healthcare provider to determine the best approach for the individual. Breast reconstruction surgery is an important option for women who have had a mastectomy. There are two main approaches: autologous reconstruction using the patient's own tissue, and implant-based reconstruction using breast implants. Autologous reconstruction typically uses tissue from the abdomen, back, or buttocks to create a natural-looking breast. Implant-based reconstruction involves placing silicone or saline breast implants to restore breast shape and volume. Nipple and areola reconstruction or tattooing can be done to complete the breast reconstruction process. Both options have their own benefits and considerations, which we'll discuss in more detail in the next slides. The topic of this slide is breast development and body image, and how societal pressures and unrealistic media portrayals can lead to body image issues and insecurity for women. However, embracing the natural diversity of breast development and cultivating a positive relationship with one's body, regardless of size or shape, can be empowering. It's important to acknowledge the societal pressures that women face, but also highlight the value of self-acceptance and celebrating the natural diversity of the human form. Emphasize that there is no single ideal when it comes to breast development, and that true beauty comes from embracing one's unique qualities. Encourage the audience to challenge restrictive beauty standards and instead focus on building a healthy, positive body image. Societal obsession with certain breast sizes and shapes can create immense pressure, leading to body image issues and self-consciousness, especially during critical periods of breast development. Pervasive media portrayals of idealized, often unattainable breast appearances can distort perceptions of normalcy and fuel insecurities about one's own natural breast development. Promoting body positivity and celebrating the natural diversity of breast sizes, shapes, and development timelines empowers individuals to feel confident and comfortable in their own skin. Challenging narrow beauty standards and redefining societal perceptions of what is attractive can help shift the cultural narrative surrounding breast development and body image. Our breasts are a natural and beautiful part of our bodies, and it's important that we cultivate self-love and acceptance for our unique shapes and sizes. Society often promotes a narrow ideal of what breasts should look like, but the reality is that there is incredible diversity in breast types, and they are all equally valid and deserving of celebration. Feeling confident and comfortable in our own skin is so empowering, and we shouldn't let insecurities about our breasts hold us back from living our fullest lives. Open and honest communication with healthcare providers, trusted friends, and loved ones can help promote greater understanding and support around breast development. Breasts come in all shapes and sizes. There is no one ideal breast type. Embrace and celebrate the natural diversity of breasts. Reject societal pressures about how breasts should look. Cultivate self-love and confidence in your unique breast development journey. Your breasts are beautiful as they are. Foster open conversations in your community about breast development. Provide mutual understanding and support. Remember, your worth is not defined by your breast size or shape. Focus on feeling empowered and comfortable in your own body. This slide provides an overview of the key resources available for breast development education. The first section highlights informative materials like brochures, pamphlets, and guides that cover the stages and science of breast development. The second section covers online resources, including interactive digital courses, webinars, and tutorials that provide comprehensive breast development education. The third section focuses on peer support, with both in-person and online breast development support groups that foster open dialogue and shared experiences. Finally, the fourth section discusses the importance of seeking medical guidance from healthcare professionals who can offer personalized advice and clinical expertise. These resources can help individuals learn about and navigate the breast development process. Breast development is a natural process that most women experience, influenced by genetics, hormones, and lifestyle. 1 in 8 women have a lifetime risk of developing breast cancer, so regular self-exams and screenings are crucial. The average breast goes through 3 to 5 major changes in size and shape over a woman's lifetime, from puberty to menopause. Embracing the diversity of breast development and maintaining a positive, empowered attitude towards one's body are key to lifelong breast health and confidence.